Hi, Jeff.
Hey, Doris, how are you?
I'm good. I told you earlier that I was just going to dive in for the sake of keeping this video short. So, the first question I want to ask you is why are you optimistic about this vaccine or the
I am
possible one?
optimistic that we will have a vaccine in December because we have available new technologies that were not available to us even as recent as just a year ago or 2 years ago. And I think for that to make sense, I need to explain that technology. So, unlike conventional vaccines, which have to be produced and replicated in fertilized chicken eggs, the kinds of vaccines that we're talking about now are recombinant. And it's a whole new technology that can be ramped up very quickly and produced in large volumes very quickly. So what that technology is involves messenger RNA. So to explain that, I have to just briefly create a tangent and talk about the difference between DNA and RNA. So everyone knows what DNA is. It's our genetic blueprint. But that's what it is. It's a blueprint. It's specifications. And something has to interpret that and translate it. Just like an architect has to translate and interpret specifications for a building. That's what messenger RNA does. It reads the DNA. It actually reads it and then translates it into messages that can be translated into proteins. Well, the reason why that's important is because the coronavirus is is an RNA virus. It doesn't have DNA. What it does is it has RNA, and then the RNA is injected into cells, which then reads the cellular DNA, which creates new proteins and new viruses. So we have the ability now, which we did not until very recently, the ability to take little sections of that genome from the coronavirus, little sections of messenger RNA, and put them in lipid capsules, little artificial cells, and inject those into our body. And what happens miraculously with that is your cells take it up, and then your cell's machinery then will start producing the proteins that make the outer coat of the virus. And then those proteins, once they made, will be shed back into the bloodstream. And so your immune system now has this huge number of targets that make it look like the virus, but you don't actually have the virus. You just have the protein spikes of the virus. And so immune system is able to attack those protein spikes. And so when you are actually exposed to the actual virus, your immune system is primed and ready to attack it. And it can never take a threat. It can never take, it can't infect your body. Your immune system will prevent it from doing so. That technology did not exist until extremely recently. And so it's because of that I'm optimistic. People are not accounting for the power of this new technology. And we are fairly far along in developing those messenger RNA viruses.
So, why is it that we're still hearing from some experts that it still could be a year or we don't know the efficacy? That's the thing that confuses me, is that I'm hearing things like, oh, we might still have booster shots, or we might have to do it more often. We don't really know. So why am I still hearing some of that?
Well, I believe you're still hearing some of that because the experts that you're listening to in that case are not accommodating new technology, and they are thinking more conventionally. And in terms of efficacy, in fact, messenger RNAs have a little bit of a special side effect. So we have two, broadly speaking, two types of immunity. We have inherent and acquired. And an inherent immunity, you're born with your inherent immunity, and the acquired immunity is what most people think about when they talk about their immune systems. Interestingly, for reasons that are beyond the scope of this discussion, messenger RNA viruses can actually activate your inherent immunity in addition to the acquired immunity, which will give it even a stronger potency than a conventional vaccine. So there's a reasonable chance, and likely, that the messenger RNA virus will actually be more potent, more efficacy, have more efficacy than a conventional virus will.
Okay. So you told me once that you think this is going to be more like the type of vaccine that we get for chicken pox or measles, and
Right.
not like something that, our yearly flu shot.
Right. So the reason I state that is because there are two broad reasons interrelated. First is the coronavirus is not like the flu virus. It presents a more stable protein coat to the exterior world. With a type A influenza virus, you've got hemagglutinin and neuraminidase, which are highly variable and evolve and mutate quickly. That's not the case with the protein spikes in the coronavirus. They're relatively stable as far as viruses go. So they create a stable target for immunity. That's one reason. The second reason why I think we're going to have longer term immunity, lifetime immunity, is because if we do go with an mRNA virus, or even in some cases a conventional virus, there's a likely chance it will induce T cell immunity. And if it does, then you will have the kind of immunity that we were just talking about, lifetime immunity with like the measles or chickenpox or some of those other diseases against which we have effective viruses now, vaccines now.
Okay. Now, you told me that you told me that you're optimistic that a vaccine will be available pretty soon.
Right.
Last time we talked, you said that you were anticipating maybe December or January.
Right.
Is that still the case, and why?
Yeah, I think December is still a reasonable target. I'm optimistic we'll actually see something by December, because I think the technology will allow us to create the vaccine quickly and demonstrate its efficacy and safety quickly. Obviously we can't cut corners, and I don't intend to when I say that I think the vaccine will be ready in December. I mean that including the typical rigorous testing that would be approved by the Food and Drug Administration for both efficacy and safety.
Yeah, but why is it possible to happen so quickly?
Well, it's only happening quickly relative to conventional vaccine development. And that's the time frame against which people are measuring this. It's not like we're rushing it or cutting corners by getting something out quickly. It's happening because of the availability of new technologies. It doesn't mean that we can't implement all the normal safety protocols that we always do before introducing a vaccine into the population. It's just that the technology is allowing us to create it and ramp it up and distribute it much more quickly than ever before. And given that accelerated schedule for development, we have the ability to test it and test its safety prior to introducing it to the population.
And then, of course, the nature of the virus itself, right? So we don't have to anticipate all of the mutations that we do with other flus, right?
Yeah, yeah, that's accurate. I don't mean to imply that the coronavirus doesn't mutate. It does. In fact, there were 4 known variants of it circulating in the world right now. But the interesting thing is those mutations typically with the coronavirus don't significantly change the target for the immune system, the external protein spikes. So there is, of course, mutation, and that's always a risk, which is one of the reasons why we want to get a vaccine out quickly and knock this thing down before it can circulate to the point where it can start mutating in ways that we don't like. So yeah, that's the case. It's relatively stable, and then I think the immune system, once it is trained to attack the coronavirus, will yield long-term stable immunity.
Okay, and then finally, what do you say to people who are concerned about the safety? I know you touched on it a little bit earlier, but just if you want to put a fine point on that, why a new vaccine would be safe.
Well, I share those concerns like anybody. I don't want to take a vaccine that's not safe, but I'm convinced and confident that the regulatory process for ensuring safety is valid and vigorous and well developed. And I will follow the safety protocols that were put in place prior to introducing the vaccine. And I'm pretty confident that those safety studies will be convincing. Otherwise, it will not be approved and not allowed to be introduced. It's not rocket science. This is not our first rodeo. We understand how to introduce safety protocols and look at the potential side effects of a vaccine. And those protocols are well developed. And so I will look at those and make sure, and I'm sure that if it is proved, that I would be satisfied with the studies that demonstrate its safety.
Jeff, thank you so much for taking this time today. I'm going to let you go, and
My pleasure.
we'll talk again soon.
Bye. See you soon.
Bye. Bye-bye.